Ladies and gentlemen, this is an article that came out in People Crime, and this is a total disgrace. And it just go to show you, just because someone is in the medical professional, it does not mean they don't have a drug problem. And I also did a story on a doctor from Canada that was in the emergency room treating people while he was strung out on opioids. And he lost his license, and he was trying to fight to get his license back so he could work again as a doctor after putting people at risk. Now we have this Washington nurse that used a needle on herself to shoot up drugs, and she took the same needle and used it on two patients, and now they have hepatitis C. And she also had the infection. I tell you, well, those patients can certainly sue the hospital and her. This came out May 7th, 2018. A Washington emergency room nurse is accused of stealing narcotics and infecting two hospital patients with hepatitis C using the same needles that she used to inject herself. That is absolutely disgusting. So she was arrested. Her name was Cora Weberg, 31 years old. She was arrested and booked on Friday on a second-degree assault of two patients at that hospital. So right now, she has not been formally charged, and her mother claims she wouldn't hurt a bug. What she did, she hurt two patients and infected them with hepatitis C. Weberg's attorney, Brian Hirschman, said Weberg denies the allegation, reports the News Tribune. The arrest follows an alert April 30th by officials. So apparently they were tipped off about her at the hospital. And it said that she had, from that time, interacted with 2,600 patients. So they are urging these patients to get tested now. I mean, they only know of the two that she did infect. She could have done more. The nurse's action violated our organization's value, the hospital chief operating officer, Chris Breslin, told reporters. We sincerely apologize to the two patients infected and the patients who need to be screened. Hospital officials said their investigation began a month ago, but they withheld their public alert until they could confirm the suspected link between the nurse and the emergency room patients. That is disgusting. What she did was disgusting. Boy, you can't even trust the people that are supposed to watch over you in the hospital. That's a damn shame. The large number of those they urge to be tested represent the number of patients who passed through the hospital's emergency room while the nurse worked that unit, August 4th, 2017 to March 23rd, the official said. Weberg intentionally contaminated medicine or other substance with her own blood. She then administered the medicine or other substance intravenously. Cora Weberg knew or reasonably should have known that her blood was likely to contain one or more bloodborne pathogens. And Cora Weberg's blood did, in fact, contain and transmit hepatitis C virus, a probable cause statement obtained by people allege. Wow. This is a terrible allegation, Hirschman, her defense attorney, told the newspaper. I hope we all stand back and take a deep breath and really look at what the evidence says. To date, I haven't seen what evidence they have that would prove she intentionally infected anybody. He said Weberg did not use any needles on patients that she had used on herself. But you know what? How do you really say that? It is no telling how many times she was high on the job. It's no telling how many times she was. I don't think they should have waited a month when they first suspected her. I think they should have just did an immediate drug test on her and find out what was going on, because it seems like apparently before these patients were infected, they had suspected something was wrong. Taking her and putting her in jail without having evidence or a cause, it's deplorable, her mother Eunice Weberg said at the Friday news conference. She doesn't think she has it. They're talking about hepatitis C. The registered nurse herself said of allegations that her daughter has hepatitis C. That's the last thing that was on her mind, that she would have something like this. But they said they already tested her and she did have the hepatitis C. I would talk to her if I had something contagious. She would do the same to me. She said, well, she's talking like a mother. You got to understand she's talking like a mother. And unfortunately, a lot of these parents aid and abet their children in their addiction. They don't want to believe their child have a problem. They don't want to believe it. And that's what her mother sounds like. She apparently has a drug problem. She doesn't want to believe it. Plain and simple. And that's not going to help get her off of drugs, unfortunately. But please tell me what you think. I think this is a disgrace. You can't even go to the hospital and be safe. Please leave your comment and subscribe. Don't forget to hit on the notification bell and join me over on Black Junction TV and blackspot.com. And if you have an Android device, please go out and get my app. You'll see the link in the comment section. Peace, family.